This is my continuing coverage of the health care bill. We are on page number 84 now, and we're going to be talking about specific requirements. The Secretary shall make the determination under Clause 1 on a per-enrollee basis and shall take into account all relevant factors necessary to determine the value of the premium tax credits and cost-sharing reductions that would have been provided to eligible individuals described in Clause 1, including the age and the income of the enrollee. So in other words, they'll first of all figure out whether you're young or old, and they'll also figure out how much you're earning. Obviously, a person earning $20,000 a year is going to have more tax credits than somebody, say, earning 4 times that much. Okay. Whether the enrollment is for self-only or family coverage. In other words, if you're a bachelor like myself, obviously you're not going to get as many tax credits as somebody that is married and has 3 kids. Okay. Geographic differences in average spending for health across the ratings area. From what I've been told, it's more expensive to get health care in California than here in Illinois. I don't know. The health status of the enrollee for purposes of determining risk adjustment payments and reinsurance payments that would have been made if the enrollee had enrolled in a qualified health plan through an exchange. In other words, those that are very healthy are going to get more out of this than the ones who are not. I guess, I don't know. But this thing just keeps going on and on and on. This determination shall take into consideration the experience of other states with respect to participation in an exchange and such credit and reductions provided to residents of the other states, with a special focus on enrollees with income below 200% of poverty. So in other words, if your income is below 200% of poverty, you're going to get more tax credits than somebody else. Certification. The Chief Actuary of the Centers for Medicare and Medicaid Services, in consultation with the Office of Tax Analysts of the Department of the Treasury, shall certify whether the methodology used to make determinations under the subparagraph and such determinations meet the requirements of Clause 2. Such certification shall be based on sufficient data from the state and from comparable states about their experience with programs created by this Act. Whew. Corrections. The Secretary shall adjust the payment of any fiscal year to reflect any error in the determination under subparagraph A for any preceding fiscal year. Like we care about any of this. Application of special rules. The provision in Section 1303 shall apply to a state basic health program and to standard health plans offered through such program in the same manner as such rules apply to qualified health plans. Okay. Now we're going to define an eligible individual. In this section, the term eligible individual means, with respect to any state, an individual who is a resident of the state who is not eligible to enroll in the state's Medicaid program under Title 19 of the Social Security Act for benefits that at a minimum consists of the essential health benefits described in 1302B. So this is a person who is not eligible for state Medicaid. They get enrolled in whatever we're talking about here, which I apparently talked about in my last video, whose household income exceeds 133% but does not exceed 200% of the poverty line for the size of the family involved. In other words, you're not tremendously poor, but you're still poor. Okay. Who is not eligible for minimum essential coverage as defined in Section 5000A of the Internal Revenue Code of 1986, or is eligible for employer-sponsored that is not affordable coverage. Okay, so in other words, you're eligible for coverage under your employer, but you can't afford to pay those premiums, so you can pay for this instead. Who has not attained the age of 65 or as the beginning of the plan year. In other words, you have to be younger than 65 to qualify for all this. Such terms shall not include any individual who is not qualified individual under Section 1312 who is eligible to be covered in the qualified whatever. Eligible individuals may not use exchange. An eligible individual shall not be treated as a qualified individual under Section 1312 eligible for enrollment in qualified health plan offered through an exchange established under Section 1311. Wow. In other words, if this person can't use the state exchange for their health insurance, they can get their health insurance through this whatever plan that they got. All right. Secretarial oversight. The Secretariat shall each year conduct a review of each state program to ensure compliance with the requirements of the section, including ensuring the state program meets eligibility verification requirements for participation in the program, the requirements for use of federal funds received by the program, and the quality and performance standards of this subsection. Whew. And you're probably sitting there going, I don't really care about any of this. So this is some state plan, and this is the eligibility requirements, and so on and so forth. And if you want to read through the rest of this, you are more than welcome. Let's go on to Section 1332, which has a waiver for state innovation. What the heck is that? The state may apply to the Secretary for the waiver of all or any requirements described in paragraph 2 with respect to health insurance coverage within that state for plan years beginning on or after January 1st, 2017. Such application shall be filed at such time in such manner as the Secretary may require. Contains such information the Secretary may require, including a comprehensive description of the state legislation and program implementation to implement a plan meeting the requirements for a waiver under the section, and a 10-year budget plan for such plan that is budget neutral for the federal government, and provide an assurance that the state has enacted a law described in subsection B2. Okay. Like that has anything to do with us. Whew. Okay. We are now on page number 86. I'm going to end this video right here, and we will go into the rest of it in just a second. Stay tuned.